I'm Dr. Richa Jagtap, Co-Medical Director and Consultant Reproductive Medicine at ART Fertility Clinics. Today, we will discuss about adenomyosis. Adenomyosis is not a very common thing that you will hear on a routine practice. This refers to a presence of a blood-filled swelling in the walls of your uterus. As we all know, uterus is made up of muscles. The menstrual blood, which should seep out of the uterine cavity, sometimes goes back and gets deposited in the wall of the uterus. This, of course, leads to very painful menses and dysfunctional uterine bleeding or heavy bleeding during your menses. Usually, the patients don't recognize this until unless they start having regular painful menses or they have infertility, because of which they are being treated with a doctor. How would we diagnose it conclusively? Of course, imaging is the basic thing by which we will see. So on ultrasound or an MRI, if we see the uterus is bulky or swollen, it has echogenic shadows, we know that this is an adenomyosis problem. Treating adenomyosis is a very difficult issue again, because treating adenomyosis means we have to stop the menstrual flow, which is what was causing adenomyosis. Stopping menstrual flow means stopping your menses completely, and this will not be conducive with pregnancy. So for women who are planning for pregnancy, usually it's better to make your embryos through IVF, freeze them, and then treat the adenomyosis, by which your doctor will give you medication and injections to suppress all the bleeding blood flow. They will also sometimes stop menses for a couple of months so that the adenomyosis already present in the uterus kind of dries up. After this, you may need a hysteroscopy to check the uterus lining from inside to make sure there's no patches of adenomyosis or fluid collection called myometrial cysts inside the uterus. Once this is cleared off, the embryo transfer can be planned, and usually these patients will do much better than with natural conception. People who are trying to look for natural conception, are younger, do not have any other indication for an IVF, are advised to still go on tablets to stop menses for a couple of months. This will dry up the previous adenomyosis slightly. It may not go away, but it may dry up slightly. Patients who have adenomyosis in a severe condition, where the uterus is very bulky and large, may sometimes be advised surgery, which is called adenomyomectomy. In this, a laparoscopic surgeon will remove some part of the swollen muscles of the uterus and clear off so that the activity of adenomyosis is reduced. As you can understand, we cannot make it a very intensive surgery because we need the uterus and the muscles to work well. Patients with adenomyosis will have slightly lesser chances of conception, but as I said earlier, their best chances of pregnancy is with IVF. If the pregnancy happens, you have to be a little bit more careful, because the uterus, as the muscles are affected, may not be able to contract very well during the delivery time. These patients may be required to undergo a cesarean section for a delivery. So it's very important to recognize this disorder early and treat it early so that it does not go into a very extensive damage to your uterus. Please visit your gynecologist or visit any of the consultants at ART Fertility Clinics to get a complete and comprehensive advice and to treat your issues as early as possible.